All right, guys, so we've drawn out her right side, and I have drawn out an area where she actually has a little bit of hollowness when she sits up. So I do kind of draw out areas that I feel as though, especially this area where the zygomaticocutaneous ligament is, I do draw out areas where I think I need to be a lot more careful, because you want to be able to place your thread into the right plane to be able to give her some lift into this area. There are different ways that we can do. For the most part, all of your threads are going to be placed more into that subcutaneous region of the fat. You just want to make sure that when you are thinking about it, you should have, when your cannula is underneath, you should have a nice, probably 3 to 4 millimeters of tissue width lifting the tissue, and we'll show you that in a little bit. So here we go to numb her. It's a little pinch, and I always put a little wheel, and you just want to be kind of like a TB. Just place a little tiny drop right at where your port site's going to be. Right here. And do one down here. So I typically will make sure I numb up the patient's face in totality when I first start off, because I want her to be nice and super numb by the time I'm ready to do one side or the other side. Alrighty. Kind of numbed her up in those areas. I'm going to switch it out just to show you. Actually, we'll do one way. So one technique is to just literally along the pathway, I just put a little drop. This is a nice thought pattern, because essentially you're literally putting drops along the pathway where, sorry, I feel there's a little, it'll not hydrodissect, because you're literally letting the lidocaine spread in those areas. The only problem with this technique is potentially you may bruise the patient a little bit more so, because you're poking through the skin a little bit more. Also a little tiny bit more discomfort for the patient by doing it this way. But I do find that it's a pretty effective way. You literally go down to kind of the deep dermis subcutaneous area, and you place a little 0.01 drop of lidocaine into that area. Another way of doing this is to use a cannula. Using a cannula, I use a little bit longer of a cannula, and this is a 22 gauge, 2 3/4. What I typically will do is, because I'm already going to use that as a port site, I actually will wait for the numbing to occur, and then I'll take an 18 gauge and actually create a little port using the 18 gauge. Okay, and the great part is that you've already created a port. When you are creating your port site for using a cannula, make sure, to me, you go straight down. You don't need to angle it in at any direction. If you go straight down and just pop the 18 gauge just past the bevel tip, you'll find that it pops right into the subcutaneous area. I give it a little twirl so that I can create a little bit larger of a port site. This allows me actually to tie off the threads, which is one of my favorite things to do with your threads. It gives you an extra anchor point, and we'll talk about that as we're placing the threads in there. So here we go. I'm going to use a cannula, and we're going to thread the tissue. As far as you can with the tip, and then just a little tiny bit. You don't need to put a lot in there, because I don't want to hydrodissect out the tissue. I don't want to overly inject the tissue with fluid, because I don't want the barbs to end up migrating later on. So you want to just make sure that you put as little as possible. I try and reach the tip if possible. So literally a 0.1 type of a thread across that whole thing should be enough into that area. Let's create the other port sites. Here we go. And typically what I do is I do create all the port sites all at one time. If you create it, if you do this enough and large enough, you will still be able to come back later on and find where your port sites are. So don't be worried that they're going to seal off or anything like that. I think that doing it with an 18 gauge, going straight down, and then kind of giving a twirl creates a big enough process for the thread to be able to go in. Okay, just to kind of show you again, turn for me just a little bit, thank you. I'm gonna pop it in. And if you guys are good with cannulas, threads are gonna be a lot easier for you guys because the whole principle is you're using a long cannula to place a thread. If you don't use cannulas, then there may be a little bit of a learning curve with threads because it is using a cannula to place the product. And as you see when I'm doing this, I do use my other hand to kind of guide where the cannula is going to be. Now the nice part is you can see all my port entry sites just have a tiny little bit of blood, so that is actually good. If I had left it a little bit longer, probably they wouldn't bleed even as much as they are right now because the lidocaine with the epi would have sealed it off a little bit better. But there we go. So we did a whole about 5 cc's of lidocaine on this side. Let's let it sit for about 5 minutes as we go talk about this. So all the port sites are all done. I typically do inject my patients laying back. I think it allows the tissue to lay back easier and allows it so that when you place the threads are placed and the tissue's already in the position that you want the tissue to be in. So you're not sitting them up and trying to pull tissue up. The tissue's already in the position that you want it to be in. So there's no point in not doing it laying down. Okay. So we are going to play around just to show you guys. We have a couple of different cog threads. They're Cobra Coglyft, so they do have a little bit more of a cut type of a thread, and so what they do is it actually sticks out like an L and it grabs onto it like a cobra who's ready to strike. And so you're gonna get nice lifting and nice grab to the tissue with regards to that. They have a 20 gauge, 19 gauge, 18 gauge. As you can see, there are differences in the colors to the cannulas. That just is dictated by the actual cannula and not by the thread, so don't worry about that. This is more based off of standard like needles. All needles in the 28 gauge range are the same color. All needles in 30 gauge range are all the same color. So that does not talk to you about what thread it really is. It'll only talk to you about the actual gauge size of the actual cannula. And remember, when we're saying 18 gauge, 100 millimeters, that is the size of the cannula. That's not necessarily the size of the thread itself, okay? The one thing that you also, when you're looking at your cogs, is you have to understand that these threads all are one long thread in here. If they are bidirectional, which means that there's 2 directions that the barbs go into, the typical thing is the end point of the cog thread is going to be your lifting portion of it. There's going to be a little transition point to allow some tissue movement in that area, and then the end point of the thread is actually going to be the opposite way that the cogs are going to go, and that's going to be your anchoring, okay? So that helps you with migration because you're going to have a portion of the thread that's going to lift the tissue up, and then you're going to have a portion of the thread that will allow the thread not to come and move downwards, because that's our anchoring. So remember, bidirectional, there's a lifting portion and there's an anchoring portion. And that's the importance of the whole bidirectional aspects of it. There are some unidirectional where it's all one way that the thread is. In those cases, you definitely need to make sure that you have a strong anchoring point, something like tying it off, twisting it, because if not, then if you happen to catch it near muscle, it's going to totally migrate and pull down your thread. And because it's all in one direction, it's going to pull the opposite direction, and you're going to get movement of your thread. So just remember, there's usages for both, depending on what you're trying to do. Bidirectional is going to be the most user-friendly and the easiest to use. Okay, so for her, we're going to probably, she has a little bit of heavier tissue down below. I'm going to use more thicker ones down here. Up in here, I like a little bit more forgiving, so I'm going to use probably a 20 gauge or a 19 gauge, just because she is a little bit thin. She has a little bit of volume loss into this area. I think that sometimes using a little bit thinner gauge, you could put a couple more threads in there if you need to, but I prefer to use a little bit more of a conservative approach for areas where I find that their tissue or the volume is not properly addressed. Now, you can definitely add volume. If they have fillers in here, you can add fillers before. If you're already going to do that a month or 2 months ahead of time, if you're already going to be doing threads as well, typically, I will do the threads first and then let the threads settle in place. And if I see a lot of hollowness, that same day I may add filler. If not, then I'll wait about a month, let the threads kind of settle in place, let them kind of mobilize the tissue, and then add volume at that point in time. So there's no right or wrong way of when you're going to add your fillers or your toxins. I prefer adding the fillers after I do threads if the patient really is going to do threads and fillers, because I think giving a nice lift to the tissue and then adding projection and volume is going to give you a much more natural look. Adding volume to a tissue that's already saggy and then you're going to pull it up, you may have overfilled a certain area, and then when you pull them up, they're going to look overly filled into a certain area. So just be cognizant of when you're actually going to be doing fillers versus your threads. If you are going to do toxins, I actually recommend you do toxins before. I personally like the idea that you're relaxing out the muscles, which could potentially pull on your threads. And so I would prefer if you do your toxins a week or 2 weeks ahead of time. You can even do it on the same day. But if you put your toxins in there, it's going to relax the muscle movement, the muscle pulse, so that your threads actually can settle in place the way it's intended to be, versus the muscle pulling the opposite direction of what the threads are doing. Okay? So we are going to get started. I'm going to take our 19 gauge thread, and they all come in these little packets. So once you open a packet, make sure you do use them all. Don't be like, unless you know your next patient, you're going to be doing the same thing and use it up in the same day. Don't let these sit too long, because once you do, the tensile strength and integrity of the thread themselves do start to break apart. And the one great thing that I love about the Viola threads is they're actually really strong, really tensile, to the point where I can actually tie them off. A lot of the threads, you have to be careful out there. A lot of distributors of threads actually buy them from Korea, repackage them, and so when they repackage them, they start to oxidize and they're already starting to break down. And so you don't realize that, and when you get there, you stick it in there and then you pull on it and it snaps. Nothing, no harm, no foul, except that now you have to throw more threads in there, but you've essentially lost that tensile strength of your thread, and now that's just a very expensive smooth thread that's being placed in there. Okay, so these all have little caps. Make sure that you do pull it out straight. I pulled it out too many times, and actually the actual plastic piece right in here slips off, and then your thread starts to move around. So be a little bit careful. Don't pull them out at angles. Pull them out straight out of that area. Remember, again, if you haven't opened them, these threads will last 3 years. Once you open them, I typically try and tell you once you open a silver packet to use them up within half a year to a year. I'm probably sure they last longer, but make sure you use them once you've opened them. Okay, so when we're doing this, I like to actually open the tissue and go straight down. So I've created my 18 gauge port site and I've gone straight. And what that does is it allows me to get straight down into that subcutaneous tissue layer, which is where I want to be. Okay, I always take then I take my fingers and actually pinch the tissue up so that I know what layer my thread is going to enter into, and I just literally twist and guide. And so this is proper position. You can kind of see there's about a 3 millimeter, the width of a forceps tissue pull when I pull up on the cannula. And that's how you know you're actually in a good level of the subcutaneous tissue layer, okay? So the goal is that you're trying to take these barbs and actually insert it into the subcutaneous tissue, because that's where you have all your dense connective tissue. And when you're able to grab on with these barbs into that dense connective tissue layer, you're actually gonna grab onto fat, grab onto the dense connective tissue and reposition the fat back into the correct area when they were used in their youth. So as I guide the needle, you can kind of see I'm staying in the same plane. You want to make sure that you're having a curvature through this area, that you really do stay in that curvature plane. And you can see for the most part the patient is feeling decently comfortable. I get right down here and I actually just felt myself pop through the zygomatical cutaneous ligament. There are certain threads that are more robust ones, like the 18 gauge. Be a little bit more careful not to pull too heavy through this area. I chose a 19 gauge so that I can go a little bit further down into this area. And I get right to the nasolabial fold, right before the nasolabial fold. You can kind of see where I'm at. Push a little bit more. And what I like to do is I grab tissue and I actually pull the tissue over the tip of where I feel the cannula. So I'm pulling the tissue over the tip, and then I actually sit there and twist. So I hold onto the thread that's out, and I slowly twist the cannula out of place. And as I'm doing that, I'm using my index finger to kind of smooth out and allow that tissue to grab on. And so you can sit here. Some people will like to sit here and actually mobilize the tissue a little bit, make sure that it grabs on. Do you need to? For the most part, you don't necessarily need to, but I personally do like to just do a little couple, 2, 3 little movement points on this. And you can kind of see how that's already grabbed onto the tissue and it's already kind of lifted her tissue up. And that's just one point. You can kind of see where that's pulled up on this aspect. Okay, we're going to take another one and we're going to go right below that. Remember, this is not a completely sterile technique, it's a clean technique, so you just want to be a little bit careful of when you are placing your cannula in the hair and stuff like that. Sometimes what I will do is I will tape down the hair so it's out of my way. You can take you can take your gauze, put a little Hibiclens or Purison, sorry about that, and you can put it down in here over the hair, and that just guides it so that you're a little bit more cleaner in your technique. I'm gonna stick it in the same hole, and you can see I'm just guiding through the tissue, and I do check. The thing that you want to make sure that you do is you've learned to grab the tissue in the same amount so that you do allow the cannula to stay in that same tissue plane. If you go and you're not in the same tissue plane, you're going to grab into it and then you're going to have this undulation of the thread in the tissue, and that's how you're going to get a little bit more dimpling. If you come too superficial, you're also going to grab to the tissue and you're going to create a lot more dimpling in the tissue as well. So you just want to make sure that you are much more careful about that. So we're going to get down to here, and what I do is I grab onto tissue over the tip, and then we twist. You guys can kind of see how that's already really started to pull her face up really, really nicely. Many with different ways that people will do this. Some practitioners will place all the threads on all the sides first before they balance and out and stuff like that. I don't think you're going to mobilize the tissue that much more, so I sometimes will place all the threads on one side and then slowly tie them off and then cut and then do the other side. That is going to be up to you and what your preference is. Some people will put all the threads on all the sides and have the patient sit up and then balance them out. That's up to you. There's no right or wrong way. The hardest part, I think, is always looking at tissue and trying to balance it out is the most important part. She has a little bit more hollowness in her tissue right in here, a lot more give. So I don't want to grab onto tissue with such a strong, robust thread. So I'm going to use the 20 gauge 100 in this area, just because there is a little bit more of a thing you have to watch out for this hollowness that does happen from where the mesenteric ligament attaches in there. A lot of patients have a very thick fibrous tissue right into this area. So you may circle this area, and when you're beginning, make sure that you stay away from that, either at the top of it or the bottom of it, and not straight through that. As you're getting good and you can manipulate the tissue a little bit more, you can go straight through that, but it's not something I would advise you start doing in the beginning. I would advise you to stay away from that area and start from above that hollowness and below the hollowness, so that, and make sure that you point out this hollowness if the patient has it already in the beginning, because if not, your patient will complain about it. If you do have a little bit more hollowness, you can end up putting some filler, you can end up using some smooth threads and fill up that area. That's not a big issue in the end of the day. So this is a 20 gauge, 100, and you can see it's a little bit thinner. We're going to go through tissue. And I get to a point where I feel I don't want to go into where the DAO is, because I don't want the DAO to pull onto my thread. So I'm going to stop here. I think that's a good position to stop, because I want the tissue to hold and pull from this angle. So I'm twisting and releasing the thread at the same time. Get a nice, beautiful. Get another 20 gauge. How are you feeling?
Good.
Good. So if she's numbed up well, the patient should not feel very much. Just more some pushing, prodding, you pinching is more or less what they should be feeling. So back in the same hole. I typically only like to do at maximum 2, maybe 4 threads out of each anchor, or actually out of each port site. And you can see this area gets a little bit tough because she has a lot more of that hollowness. So I'm going to go down right to her jowl and pick that up and pull this tissue up above it. And slowly do that. And you kind of see how we've pulled up her tissue. We're really starting to see that come up nicely. A little bit of puckering you can. I think the one thing I do like about these threads is that if you do feel as though you've overly tightened them, you can hold the thread at this side, push down and push in the opposite direction, and that will kind of loosen a thread up. The patient and you will feel a little pop. So that's kind of where I think these threads are great, because it gives you a little bit more versatility and flexibility in the beginning. All right, so we're gonna start off. One thing you want to make sure is you want to stay about 1 finger breadth away from the lateral canthus, just because there is the orbicularis muscle and you don't want that pulling on your thread. So just make sure. Oops. Sorry. I think we're not numb yet. Sorry. I probably should wait a little bit. Let me finish this, put this in, okay? this side hurts more, sorry.
Yeah.
I'll try and finish this side faster. Okay. This